So let's talk post-op protocols. These protocols are there for a reason. If you've had shoulder surgery, back surgery, neck surgery, hip surgery, ankle surgery, whatever, knee surgery, whatever it is, there are certain guidelines that we have to follow. And so while sometimes that comes across as really conservative, what it is really doing is protecting that procedure. It is allowing time for healing to happen and for the tensile strength of that tissue to improve so that we can then progress forward. Now, we consider ourselves a very progressive group, and we want to get you back to a higher level of function than most other PT groups out there. But we need to make sure that we're following the rules, and not just the rules of the protocol, but the rules of tissue healing and how the body works. So there's going to be times within the rehab process where we're going to hold you back and say, hey, you can do this, but don't do this yet. And while it might sound like we're being cautious, we're going to try to explain the context, but it's really to make sure that we set a good foundation moving forward. And if we do anything, and I say we collectively because this is a partnership, right? If we do anything, or if you do anything out there in the real world that is above and beyond where we should be at, that can compromise our success moving forward. Now, it's totally common in rehab sometimes to, as we start doing more things, sometimes things get a little flared up and we have to take a little step backwards. Like that's normal. We're all okay with that. But what we're talking about is doing something way too much, too soon, way above the tensile tolerances of that tissue that could compromise our long-term success. And again, that is part of that protocol. That is what we're going to try to protect against. And we want you to get back to doing all the really cool things. Surfing, snowboarding, mountain biking, like CrossFit, whatever it is, we are going to work on getting there. And it's not just how fast you want to do it, but really, are your tissues ready? So that's why we're following those. That's why we're going to ask you to follow those. That's why they're going to ask you to trust us that we have your best intentions and your long-term goals in mind. So just something to think about as you're thinking about your post-op status and what I can do when I can do it. This is why.